Thomas Baldrick here at ASH 2014. Happy to have with us Dr. Guillermo Garcia-Manero from the MD Anderson Cancer Center in Houston, Texas. Thanks for coming back again this year.
Thank you.
All right, let's talk first about the phase 3 study that you've got data to present here at this conference.
So this is a study that I think is a very important trial, where we looked at a compound known as Rigosertib. We used to refer to this drug as Onconova 1910, ON1910. And this is a drug that has shown preclinical activity in models of leukemia and myelodysplastic syndrome. And there was a hypothesis that this drug could work or have a clinical effect in patients with what we call hypomethylating failures. As you know, in myelodysplastic syndrome, indeed you invited me last year, we were talking about how these hypomethylating agents are frontline approaches in patients with this disease. But we know that there is a high rate of failure in terms of resistance and relapses with these hypomethylating agents. And one of the major unmet needs that we have in myelodysplastic syndromes is basically the development of second-line therapies for patients for whom these hypomethylating agents are not working. So the first drug ever to be tested on a phase 3 trial is Rigosertib, and I'm proud that I'm going to be presenting these results tomorrow in one of the oral sessions.
How did you choose this for a long-term therapy?
Well, you have to find an equilibrium between the toxicity that the drug has, because this patient population could not really tolerate a high-intensity type of approach. And indeed, actually, we've used this type of treatment and it's been suboptimal. So we felt that the mechanism of action of this compound, the toxicity profile that in other studies has been shown, actually made it an ideal candidate for this approach. And the data that we are going to show, unfortunately, did not meet its kind of like predefined statistical mark that would have led to approval of this compound for patients with myelodysplastic syndrome, but has been very positive and interesting in my view. So first of all, the drug shows a benefit in terms of survival, even if it's not significant. So patients on the investigational arm lived close to 3 months more than patients on the control arm. And then we learned something important from this study, that is, these hypomethylating failures are actually now divided into what we call primary failures and secondary failures. And we learned actually that the drug has a significant effect in patients with primary failures. So this is very interesting because we didn't know about this. So in the future, very soon, there are going to be studies that are going to target this specific subset of patients that are primary failures with high-risk features with this compound. And I think if we're able to reproduce the data from the original phase 3 trial in this very specific cohort of patients, I think that our patients will benefit from this, and hopefully this will lead to an approval of this particular compound. The study also showed that the drug was very non-toxic. It was very well tolerated, and this is very important because, again, this is an older group of patients that do not tolerate high-intensity therapy. And I think the most important goal here is prolongation of survival and the best quality of life possible.
At this point in time, what do you see of the significance or the impact of what you found?
I think the impact is basically the discovery of this subset of patients with what we refer now as primary hypomethylating failure. So these are people that do not respond to drugs like azacitidine or decitabine. And the data presented that will be presented tomorrow will show that for this specific subset of patients, it appears that the drug is highly effective in terms of improving survival. That said, this has to be confirmed in second studies, because the reality is that we did not plan for this because we were not aware. This is a new discovery. So now this divides these patients into 2 subsets, and I think the important message is that we need to confirm this data with another set of clinical trials where we're going to be looking specifically at this group of patients. I think this is going to be very important.
Good work, sir, and best of luck in your future work on this.
Thank you so much.
Okay.